Hey, have you ever seen a video filmed in the operating room of somebody who's just had a BBL and it looks lumpy and bumpy and very like a lot of cellulite? And I get a lot of comments from people like, oh my God, it looks terrible, but it doesn't end up that way. And let me explain to you why it looks that way, why it doesn't stay that way, and how the whole thing works.
Behind the mask. The more you know, the better you look. Behind the mask.
Remember, I talked about a long time ago that if we didn't have any fascia in the body, our bodies would just kind of fall off our bones. And so if you look at the butt and you look at the layers of the butt, you've got your pelvis, that's your bone, that's a deep layer. Over top of that, you have your muscle. And then you have a thick fascia over top of the muscle. That's what we avoid. That's what we don't go. That's the thick white band on top of the muscle. That's where we don't go below. And then you have this other fascial layers that keep your skin attached to your muscle. And those are the ones that look like a spider web, or they look like this bubble wrap. Your fascia layer in your butt is very much like this bubble wrap. And this was taught to me by Dr. Pat Pasmino. He's a very famous surgeon in Miami for being an expert in ultrasound when it comes to BBL. If you really consider this bubble wrap to be sort of this configuration of this fascial layer in the butt where we inject the fat, all of it's not as soft and as wimpy as this. Some are more like leather and really, really, really tight and very, very strong. There's areas where if you put the fat in, you'll see there's a weaker area, and so that'll start to go towards the skin, and that'll leave a little indentation or a little mark on the skin. That's what you're seeing when you see that intraoperative, you see that result of a BBL in the operating room that's real lumpy, is you see some of those little areas of fat that are poofing up into those areas. But eventually, after about an hour or 2 hours after having a BBL, you don't see that bumpy pattern anymore, bumpy on the skin. I just invented a new word. You don't see that bumpy pattern on the skin anymore as everything just kind of settles with gravity back down. But it brings up another couple of points that I want to make. You can have somebody that has really not very much space to inject. They don't have much fat in their butt to begin with, but you can really get some very good projection because that fascia is very soft and it allows the fat to really expand the area. You can have other people that have a same small distance, not very much fat in their butt, and they can be very difficult to get projection. And that's where I was talking about tissue distensibility in the past. But now I can really show you with the ultrasound exactly what I mean, in that you can have a small area of fat, but you can't really get much projection because those fascial bands that are in there are very strong. And they will prevent the fat from coming in. They just won't allow it. You simply can't push the fat hard enough. It won't allow it to distend. And so all of that relates to the fascial system in your gluteal area, different thicknesses, different strengths of it, and all of those things work together to give you a different result in every single patient, because all of us, even though we have the same configuration, all of us have differences in that configuration, whether it's thickness, whether it's strength, that give us different results.